From the News Channel 5 Network, this is Medical Mondays.
And good evening, everyone. Rory Johnston here, your host tonight for Medical Mondays on News Channel 5 Plus. Thanks so much for tuning us in. For the next hour, we are speaking with a local expert on a specific topic, and it's your chance to call in and talk directly with the doctor. And tonight, we're pleased to welcome Dr. Tif Siragusa, who's here from the Siragusa Vein and Laser Center. Doc, thanks for being here. We really appreciate it. Thanks so much. We're going to be talking about all things veins. He is a vascular surgeon, vein disorders, and cosmetic treatments. So don't be shy about calling us in at calling in at 737 plus everyone 737-7587. All right. We have some also before and after varicose veins and spider vein pictures that we're going to show you throughout the night so the doctor can talk about it and really give us some specific examples.
Sure.
What does a vascular surgeon do? And what do you...
Yeah, so a vascular surgeon is specially trained to deal with all the circulation in the body. And that really comes with two forms, arteries and veins.
Right.
So arteries deliver blood away from the heart to the brain. For instance, the carotid artery delivers blood to the brain, and when there are problems with the carotid artery, people can have a stroke.
Right.
The aorta, which is the main blood vessel down in the belly, can dilate and become an aneurysm, and when those get too big, they can pop and are very fatal.
So very, beyond the cosmetic aspects, these are very serious medical conditions that we're talking about, right?
And when it comes to veins, the typical problems that people have with their veins is in the legs, and those come in the form of spider veins, which are flat, discolored areas of patchy veins, and varicose veins, which are the bulgy ones that you can stick out and you can feel through the skin.
Mm-hmm. What are the treatments like? I mean, when we talk about the leg, the spider veins, varicose veins, here in the year 2015, we hear so much about the advancements of treatments for these issues.
Right. Well, for spider veins, the mainstay in treating those is injections. Mm-hmm. And there are two FDA-approved medications to inject spider veins with that work very well. Traditionally, people used a strong salt water to inject them, which worked on about half the veins that were injected, but caused a lot of burning, a lot of pain, and a lot of side effects like discoloration. Mm-hmm. Today's medications that are available do a much better job. With varicose veins, traditional surgery involved a 2 to 3 day stay in the hospital, several incisions on the leg, and today's therapies, which involve radio frequency, heat, and lasers, really take about 10 minutes, are done on an outpatient basis, and people go about their daily business as soon as you're done.
Lasers really have been a game changer, haven't they?
Yeah, the lasers have been used in a lot of different forms of surgery and medicine, and with veins, they really did help change the entire landscape on how we treat this problem.
Mm-hmm. So as a vascular surgeon, you're dealing with all sorts of issues then on a day-to-day basis, right?
Yes.
And instead of just focusing on one issue.
Right, and one of the more common areas that we focus on as vascular surgeons is the legs. We see a lot of people don't know what is wrong with their legs. They know they have pain, or they have leg swelling, or their legs don't look normal, or maybe they have a wound that's not healing as quickly as it should heal if things were normal. And we evaluate a lot of these problems and oftentimes find an issue in the circulation that can be corrected to help solve their problems.
Mm-hmm. Excellent. 737 plus rather is the phone number if you would like to call in. We have one caller on hold right now. Hang in there, and of course we're expecting more. We'd love for you to call in tonight as we discuss vein disorders and cosmetic treatments with Dr. Siragusa. What are the most common things that people come to you for? Would it be the leg issues? And is it mostly women?
It is mostly women. It's probably about 2/3 or so women, and about 1/3 men. Men typically will come into the office at their request or after they're dragged in by their wife or significant other.
Okay.
And their problems are usually a little bit more advanced by the time they seek help for it.
Because men, we don't like going to the doctor.
We're busy. Right? We just have aches and pains and just would rather just deal with it than take any chances on finding out what it really is.
Right, no doubt. All right, let's go to the phones and welcome Carl. Hey, Carl.
Yes.
Welcome, sir. What's on your mind?
Doctor, I took me off cholesterol medicine there, and I was supposed to take it off for 2 weeks, and they put me on some blood thinner.
Yeah.
And my hips and legs, they just ache, just hurt all the time.
What was the aching in your hips and legs? Did that come about after you started the cholesterol medication?
No, back when I mean, it's been about 8 years ago and stuff. I broke my back and stuff, and I had 3 stents put in my heart, and they put me on that cholesterol medicine. But last year and a half and stuff, I've been having a lot of problems, and I'm trying to get the doctor and stuff, And,
Sure. Well, a common problem that people can have who have heart disease, that have stents in their heart, they can also have blockages in their legs. And blockages in the legs can cause crampy pain, mainly when you're walking. The muscles of the legs do okay when you're just sitting down or laying down because they don't demand very much oxygen just to be at rest. But when you get up and walk, you reach a point where you're not able to get enough blood flow to those muscles, and they ache and hurt you. And that's something that's readily assessed with an ultrasound.
What are the typical kind of assessment tests that you do when a patient comes in?
When patients come in primarily with leg complaints, we do an ultrasound. And the ultrasound is a great diagnostic tool for vascular problems because there's no radiation, there's no IV necessary to give any contrast. It's pain-free, takes about 30 to 45 minutes, and the information that we get from an ultrasound tells us if there are any blood clots present, tells us if the blood's flowing, in which direction the blood is flowing, which is important with varicose vein disease, and it also tells us in the arteries if there are any blockages.
All right, Carl, thank you very much. Let's go to Polly next, who's on line 2. Hi, Polly.
Hi, how are you doing?
Doing well. What's on your mind?
I'm having problems with my legs.
Okay.
I have had quite a bit of surgeries on my knees, my hips, everything has been replaced, and they claim that that's why my legs are not holding up. Just lately, my toes will turn, I sit down, my toes will turn black.
Wow.
And I'm wondering if that has anything, well, of course it has to do with circulation, and I'd like to know if he could help me.
Well, Polly, a lot of patients that we see have had surgery on their hips or knees before. A lot of patients have other problems like back problems that can cause leg pain. And, everything's...
I don't have any pain.
Okay, just discoloration?
Just the discoloration? Okay, hold on. We're on hold for a second.
Yeah, and the discoloration is often a sign of blood flow problems, either not getting enough blood to the leg or trouble getting the blood that is delivered back out, and your leg can become darker or blue or like she's describing, black.
That's got to be frightening.
It is.
First of all, to see that.
Yeah,
right?
Yeah, and oftentimes it's just a problem with the smaller blood vessels in the legs that really aren't going to lead to any problems, but a lot of times you get some peace of mind with having an ultrasound and having a test and coming in and being reassured that it really is not anything that you have to worry about.
Okay.
Yeah.
All right. Thank you, Polly, and thank you to Carl. And we have wide open phone lines if you'd like to call in now at 737+. Thrombosis and insufficiency, 2 main categories of vein disease, right?
Right.
Thrombosis I've heard of, but when you just say insufficiency, maybe go over both of them a little bit for us.
Yeah. So veins have one job, which is the leg veins, that is, have one job, which is to bring blood from our legs back up to our heart.
Right.
And it's a pretty difficult job with gravity trying to keep all the blood down in our legs. So veins are equipped with valves on the inside. The valves open to allow blood flow upward, but then they close to not allow that blood to come back down. If those valves don't work properly, it sets up what's called venous insufficiency, which means in that particular vein, the blood's moving backwards, back down into the leg and out its branches. And that underlying problem is what sets people up for varicose veins, spider veins, and even skin ulcers in extreme cases.
Yeah, I was going to say, then what happens to, say, the lower leg and the feet? Do they swell? Do they what? I mean...
Right, if you can't get that blood that's being delivered to the leg out, the legs will swell, and depending on the territory of skin that's literally being drained by that particular vein, you can have discoloration, you can have extensive spider veins in that area, and also skin breakdown where you have an open sore. Thrombosis is when you actually develop a clot inside of the vein. So the valves are working fine, you just develop a very soft clot in the vein, which acts like a roadblock. All the blood's trying to come out, but now with this clot sitting in the vein, it can't get past there, so you develop swelling and pain. That's often on one side. It's often after a long car ride, after a period of immobilization like surgery, and it's a very very common cause of disability and death in the United States.
Right. This is what we hear about long plane rides, international plane rides, the importance of getting up,
Right.
moving around,
Right.
stretching, getting some movement instead of just sitting in one place.
And it can happen at any age. Serena Williams, for instance, had a blood clot after a continental flight. And
Right.
was pretty sick from that.
Pretty scary.
Yeah.
Okay. With that, we're going to take our first break, everyone. Come back with more of your phone calls. 737 plus if you'd like to call in tonight on Medical Mondays. We'll be right back.